all stand for the pledge?
Oh, I know.
I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. We are fortunate to have for our first group under item 4A, the Clerk Register of Deeds office. So welcome.
Thank you.
We hear you're not slide people.
I'm not what?
Slide people.
I'm not sliding. No.
Okay.
Okay. Yeah, I don't know what's in the slides. I'm not talking about the slides. Sorry.
It's okay. They're pretty straightforward.
Okay, wonderful. Okay, I guess before I get started, I just want to reintroduce, unless there's somebody new who doesn't already know, my SMEs, as I call them, my subject matter experts, my chiefs. Jennifer Howden, Chief Deputy Clerk, Craig Jones, Chief Deputy Register of Deeds, and Joe Roselle, Director of Elections. Couldn't do what we do without any of them. You have no idea how lucky we are to have them in Oakland County. Okay, I just wanted to start by saying I can't think of any impending legislation that will impact our budget, but if a proof of citizenship is required for voting, that would have an impact on our office. That's going to have an impact on staffing. It's also going to have an impact on printing costs, the way that the possible ballot proposal language, we don't know if that's going to be on the ballot yet, but we would have to print more ballots because there would be different ballot styles. That some people would just be voting in the federal races, so we would have to print a different ballot, so that cost would be higher. And then also potential criminal defense costs for a team member who acted in good faith, because there are criminal penalties for people who register people to vote, et cetera. Register to vote and don't follow what's in the language. So I know people, I think we talked about this.
This is pending legislation?
No, this is, so there is a, signatures were turned into the state to have a proposal on the ballot for November. We are waiting for the state to go through the signatures to verify that they met the minimum requirement for those signatures.
Okay.
So, and of course, there's talk at the federal level as well about requiring proof of citizenship as well. So just wanted to throw out that there could be financial impact to my office, and that obviously I have no control over that. And I think we mentioned it last year. I think we were asked about it last year, and that is about new voting equipment. I still don't know what the price will be, or even kind of when we're going to purchase. The RFP process is still going through at the state level. But just so you have that on your radar a little bit down the line. The legislature did put in $41 million into the budget towards it, but again, without knowing what the full price tag is, I can't tell you like how good or bad that is. Okay. I haven't had a chance to go through the budget as thoroughly as I did last year, but there are some things I want to point out. You may see, well, you're going to see an increase in infotech development and infotech operations in the Register of Deeds area. That's due to our new vendor. With our prior vendor, they provided hardware. They also stunk, but besides that, I did sue them for breach of contract, and we spent all day in mediation yesterday, and there will be money coming back into my budget. I fought for us, and we prevailed. So I look forward to that being done. But anyways, so we now have to get our hardware. We have gotten our hardware from the county, from IT, and so there's ongoing costs with that. So those were costs that we never had before because it was always with our vendor, but now it's all with the county. So we never even had anything in those line items before in Deeds, but now we do. So I wanted to explain that. to give you a heads up and a thank you again. I appreciate the money that you allocated to us last year to get our historic vital records scanned in. Unfortunately, I'm going to need to have that money carried forward. Purchasing retracted the RFP for issues on their end, and I guess you can ask them about what happened with that. It's a little frustrating because we've been pushing to have this happen, and people even responded, and we're not even allowed to know who responded because whatever was wrong with the RFP that they put out. So I don't know. So I'm going to need that money carried forward so we can finally get that project done. Moving forward, you're going to see an increase in office supplies. One is a one-time cost, one's an ongoing cost, and it's mainly from two things. The one-time cost was air purifiers, the ongoing cost is water. And I'm going to take some time to get into this. Did you guys pass out? Yep, okay. We have some, go ahead. You want to pass them out? Okay. Accessibility has always and continues to be a top priority of mine.
Thanks.
That's why I opened a satellite office for Vitals, offer many services online, and travel around the county with our local office visits. And I want to give a special shout out to Edna Burton Senior Center, where we held a local office visit on Tuesday. Thank you for hosting us. So I hope you can understand how horrible the situation had to be on Thursday, July 16th, when I closed our office early. 3 employees were checked by EMTs. 1 was taken to the hospital, one of which threw up on Thursday. Another team member threw up on Friday. 5 people went home feeling ill, not counting the one that was taken to the hospital on Thursday, and some didn't come back on Friday.
When was this?
Thursday, July 16th. Yes. On Friday, another stayed home who had stuck it out on Thursday but felt too ill to come in on Friday, and 2 left early on Friday. The air in our area, especially in the Clerk area, was beyond unbearable. It wasn't just a smell. Eyes and throat were burning. I had a mask on, and it was still burning my throat. It felt toxic. We were lucky to find some small air purifiers Thursday night. Thank you, Jenny. In addition to purifying the surrounding air, these purifiers measure the air quality as well. When they were turned on in the Clerk area Friday morning, they all measured at a poor air quality level. And that's in what you were just handed out. I took pictures of each of them. 27, 24, and 19%. That is toxic. Just for comparison, when they were plugged in the elections area, the air quality was excellent at 99% on Friday.
What can I say?
I'm thankful that FM&O rented industrial air purifiers Friday night, so when we got in on Monday, it was much better. Not 100%, but we were in a good range, and now we have eventually gotten to 100%. However, there is clearly a problem with airflow or something in the Clerk area. This is not my area of expertise. I have asked for an inspection or a study, but have not heard anything. I fear this will happen again, and I cannot and will not subject my team nor our customers to such a health risk, nor the county to such a liability. I would suggest the county purchase industrial air purifiers and to please figure out what the problem is. Even walking from Deeds, which Deeds was bad too, but even walking from Deeds or from my office into Clerk, you instantly felt the difference. I didn't even mention the headaches. It was literally unbearable, and it was a really hard decision for me. I don't want to say it was a hard decision for me. It was hard for me to close the office. I've never done that. I could never imagine doing that, but I could not endanger my team or our customers in that environment. Our windows have leaked when it rained. I don't know if we have mold. I asked about that and I got no response. We have Legionella in our bathrooms. At least the last results that were shared with me showed that our bathroom was still positive. The backflow preventers haven't been tested in accordance with the law and were only tested after I asked about it, and they had failures. So we have Absol water coolers in each of my areas because I have no assurance that the water here is safe. I received an email from the Water Safety Committee, which I was surprised by because I know when it was being talked about being formed, it was said that elected officials were to be included, or at least some, as well as the union. And I never heard anything, and know that I've been pretty vocal about the water issue, so I would have thought maybe I would be included, but I did check with Joe if the union had ever heard, and they never heard anything either. So I guess I would say that was a broken promise of who was going to be included in this Water Safety Committee. And I know what I'm going to say next sounds like an exaggeration or, I don't know, hyperbole. It's not, because this is how I feel. And that is, and I'm getting emotional because I really do feel this way. Sometimes it feels like someone is trying to kill us. The water, the air, and of course we have no fire suppression. The role of the government is to protect the health, safety, and welfare of the people. I am asking you to do just that. It is not part of my statutory or constitutional duties to know about fire suppression or air quality or plumbing maintenance, right? I'm the keeper of the record. I'm the chief election administrator. This is not my wheelhouse, and it shouldn't be. And for those of you who have been a commissioner for a while, you know that hopefully you remember that my presentations used to be very different. But the negligence of other departments has an impact on the functionality and success of mine. It wasn't always like this. My goal, again, is for Oakland County government to be the best government that it can be. And I hope we can all work together to make that happen. And I'm happy to answer any questions.
Okay, I'll open it up to the floor. Commissioner Spiz.
Thank you, Madam Chair. I'll go first. Can you send me any of the emails that you have with facilities or whatever about the concerns you just shared with us? So that,
On all the subjects?
I don't need all of them, but.
Which
on the
subjects do you
water
want to
and air
know?
quality with this issue from July 16th.
Right.
And maybe you sent, Madam
Well,
Chair, maybe you sent it to
The
the whole board.
whole facilities
It's news to
question.
me. Right, it's news to me, but I hear your frustration and I feel your concern because I would have the exact same concern. So I would like to be able to at least start some communication to get it addressed. And being an engineer, I'd like to understand why things go bad so I can truly fix it versus throwing in a Band-Aid, which, I'm sorry, but your air purifier is just a Band-Aid.
Oh, believe me,
understand.
I know that,
Yeah.
but we had to do what we could, and if we
Right.
couldn't have bought those, I would have had to have closed on Friday.
Okay, so if you could send us at least a couple, one on water, one on air quality, at least the latest ones you may have had with them, and then way we can start to address it. And at least add
Yeah,
it to
somehow
our
we need
target.
to convene facilities and you guys to really have a serious set of priorities, steps to take, and so on. I mean, yeah. Commissioner Spiz is asking the right question.
Yeah.
And I'd
Yeah,
love to be
I'm-
on the water quality committee if I'm allowed to be.
And what? You're on
I'd love to
the
be on the water quality committee, right?
Water Safety Committee?
Whatever we call it, yeah.
That's out
If I'm
of
allowed.
facilities too? Is that a facilities group, do you know?
I remember that it was, I remember that it was discussed at, what committee meeting was that we were at? No, but we were at, it was a committee, one of your committee meetings, not finance. It was,
Probably Lago.
maybe it was Lago, I can't recall, but, and it was discussed, it was when health and, that they gave, right, ND, risk management, they gave a presentation on Legionella.
Oh,
That's when it was.
okay.
You were there.
I was, I'll have to dig it back out.
And they talked about creating a committee, and they said, and they were saying like who was all going to be on that committee, not names, but like people from different areas, including the union. They said elected
remember.
officials, because I remember sitting next to a reporter who said, "Are you going to be on it?" And I said, I haven't been asked. I don't know. They're just talking about it now. It's the first I've heard of it. And She said, well, I think you should be because you talk about it. But anyway,
That's the one I remember.
now you remember? Okay, good.
Is that it,
Yes,
Commissioner?
I'm done, thank you.
Okay, Commissioner Smith-Charles.
Thank you, Chair. So, Ms. Clerk Brown, what you've shared seems separate and apart from the hearing information today. Like, what was the ask? You need filters or?
I need someone to figure out what's going on in our area. I want things fixed, right? We shouldn't have windows that when it rains, we put all the plants over there. I mean, Craig has joked that's our fire suppression. It's not funny. It's a little funny, but it's not funny, right? I mean, this is where we're at.
So I don't know structurally if this is the case, but like, for example, there's a flyer on the wall in another room with an email address for facilities to report anything. Is that something that has been working for you all? It sounds like no.
I mean, I've contacted Ed Joss.
Okay. Okay. And
Again, like, these aren't my areas of expertise. I would like whoever's area this is,
yeah.
right? And if you need to hire outside people, whatever it is, but I can't tell you the difference. Like, there's clearly a problem. And when facilities came down and they did something with the damper, right? It did make a difference. So it's something, again, not my area, something with the airflow or something. I know they closed them, so outside air wasn't coming in, but maybe that locked it in our area. I don't know.
Yeah.
I don't know, but
Indoor air quality is very important to all of us, and nothing you said is outside of reasonable. It's just concerning because, you know, we do this ED&I dance, and, you know, we had facilities here last week. We've had risk management say that Legionella was eradicated. We've got sustainability that is referring to AECOM and some studies and what have you. So it's a lot of lip service, but we want to make sure it meets where the people are. So, you know, and my facilities people know I'm like a dog with a bone. I'm relentless. I've already texted the executive. So let me just narrow down my stuff to some of the finance questions, but just know what you just said is not lost on any of us. We look forward to supporting you on that.
thank you.
So your presentation, to which you don't do slides, says that there have been changes from election billing, land transfers, recording fees, certified copies, photostats, blah, 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 blah. And so which revenues do you feel which revenues are reliable and which do you find are the hardest to predict?
I mean, I think they're all hard to predict. I don't know when babies are going to be born, or people are going to get married, or people are going to pass away. I mean, we can tell a little bit if we're ish with the market. As somebody in real estate, you know, like we can, for deeds, if the interest rates go down, people are going to be refinancing. We had that like in 21. We had a ton of refis that were recorded. So, you know, that means more revenue on that side of it. And then, yeah, I mean,
Okay.
but I don't have a crystal ball, and then, yeah, I mean, transfer taxes, huh? Oh, and with courts, huh? And bonds are heard, okay. Well, in courts, we don't know how many lawsuits are gonna be filed, or how many people are gonna pass the bar and get sworn in as an attorney, like,
Okay.
you
A lot
know.
of variables. The last one I'll have is to that same feeling and thinking, are there any unfunded needs? I feel like you've already said some of them.
Yeah, I mean, it's.
But if you had to hone in on any unfunded
Yeah,
needs.
I mean, these are things that I feel like a broken record, but if I had a wish list, right? I mean, fire suppression, obviously a safe working environment for all of us in every level, water, air, everything, right? A separate, I want to say enclosed, I guess, break room for deeds. I've been saying this for a while. They don't have that. So, you know, we're public facing. When they're eating their lunch, customers can see them. And because we have split lunch, because we have people constantly coming in, usually around lunchtime, right? So there's people who are eating lunch, and right across from them are people who are working. And it's disruptive to them. It's disruptive to the people who are still working, and it's not a complete break, right? There's no like separation from those who are taking their lunch or a break. So I know we're talking about generators for emergencies. Our phones went down for a little bit on election night, which was stressful. It's mostly infrastructure stuff. And I know when we did have a meeting with Misty about the capital improvement, but some of these things I don't feel can wait that long.
Yeah. Thank you so much, Clerk Brown.
Thank you. I'd love a raise too if we're throwing things out, and for them to have a raise, but you're asking.
Commissioner Erickson Gall.
So remind me, the fire suppression issue is for the older records that are stored, or is this everywhere?
Fire suppression would be everything on this side. Elections has it because they're in the West Wing, but nothing on this side. Deeds and clerk, we don't have fire suppression.
Okay, so it's the entirety of in the tower, in the 1200 tower.
And the East Wing, yeah. East Wing and tower.
Okay, got it.
And again, I know I think they're talking about it with this capital improvement plan, but again, that's years out. And, when I had that company come out just to give me an idea of like what the options were, they have gas tanks. I don't think it's the most cost effective, but it's something that wouldn't require ripping up the ceilings and all that sort of thing. And I say it's not the most cost effective just because if a tank goes off, you can't use it again. So then you'd have to purchase another one. But it's something that could be done, right, like tomorrow.
Right. Well,
Which might be a slight exaggeration, but it wouldn't require ripping out the ceilings and all that, I don't think so.
I recall us discussing last year about fire suppression for the archived records, all the stuff you had on paper, and there was an effort, correct me if I'm wrong, there's an effort to digitize those older records.
Right, that's what I talked about, that I'm going to need that carry forward because
Right.
because purchasing did something with the RFP that wasn't correct. But that doesn't, that was a fraction of what really needs to be done, right? That was just our vital records books, our historic vital records books. That doesn't touch anything in the deeds office, which we got a quote for over $1 million, I think, to do that. Those records, those historic records. I mean, I was, I feel like Oliver Twist, please sir, may I have some more. I mean, I've been asking for all this. Would it just be easier if we had fire suppression? I mean, it's great to have this stuff scanned in. Absolutely. Make it more accessible, yes. But it's, to me, as the keeper of the record, I need to make sure that these records exist forever. And if, God forbid, we have a fire in this building, they don't. And, we lose a lot of important information, so.
Okay, you still have the floor, Commissioner? You're done? Okay. Commissioner Taylor.
Good afternoon, Clerk Brown. A couple of things. First, I want to say thank you to our elections area. I like the online filing that you have. I really like that. It's really easy to do.
Yeah.
My only problem is how to remember that link. So I'm going to put that out there to find an easier way for us to remember that link, because once we're in, that's good.
Yes, thank you.
And
I will tell you, that took years. That was years in the making. And we are, again, always looking to improve, as I do with everything that we do, always looking to improve and expand. So for those who care, and she's talking about our campaign finance, submitting your campaign finance report. We are looking to expand that to ballot questions, committees, those committees, and what did you say?
Political action.
And political action, yeah, PACs. So looking to expand that.
Yep. So
for more.
along those, I was just going to ask, how are you measuring whether those are, well, I'll just ask my question, whether residents are getting faster and easier service through online access like I do, records modernization, and your counter service, because again, and I have nothing but high praise for everyone at the counter. Every time I've come, they've been able to answer every question, even when I didn't know how to formulate the question. So I really appreciate that.
Thank you.
But that was my question on that too.
Yeah, you know, and I think that's a good question. And again, as I said, accessibility has always been a top priority of mine, so having things available online. We have on there people, you know, sticking with elections right now, we have a list of everybody, every candidate or committee that owes us money. You know, they didn't file a campaign finance report on time, or, you know, basically that's it, or some other filing, right? There's a statutory fee for that, a fine for that. That's all listed online, so anybody can go see. And especially, and I bring that up for people who then file to run again, because if you owe us something and you sign that you don't, you just committed a crime. So it's open for anybody to see, including anyone running, like, do I owe money? You have an obligation as a candidate to know that. And I think with, I mean, I'm very proud of our super index. It is such a user-friendly tool for anyone to search our property records. And again, you know, how long have I been here? 20 years ago, so before I was here, you had to pay to search. That was how it worked. And to me, that did not make sense, just to be able to know what records we had. These are public records, so, you know, we changed it. You can search. You can't see the whole document for free, but you can at least see what's been recorded. So making, again, information more accessible. Of course, partnering property records notification with that, so people can be notified electronically, whether through email or text message, if something's been recorded on their property. I mean, we have people who order vital records online. They have to send us their driver's license if it's a non-public record. But I mean, you know, that's every day we're accessing. And then of course with courts, I mean, we are an e-file court. We have been for a long time. We piloted that. And Court Explorer is our online database for people to search those records. So, I mean, we try to make it as much as possible that people don't actually have to come here. You know, there's some things they do have to come here for. Some things you have to be in person for, like applying for a notary. But, you know, again, accessibility is a priority. And so I think that we've done a lot to make all the information that we have accessible online. Oh, okay, yeah. Oh, well, because we had a change in the law. Okay. Joe's reminding me. We had a change in the law in the end of 24, I want to say, that allowed us to have people who wanted to work the election to apply online. Before, the law said that it had to be like a wet signature. They had to be a paper application. And as you know, we hire hundreds of people to work our early voting sites, as well as our combined absentee voting counting board. And it's a really nice platform that we have, that people can say what days they want to work early voting and what site they want to work at. And we can communicate with them through that. So that's another, thank you, that's another newer thing, and another online kind of tool that we have.
Excellent. I also ask all the departments about succession planning. I know yours is an elected position, but you have key positions within your office that your office could not function without. You've identified those, and have you put in place?
They're not allowed to leave. I've told them that. They're not allowed to leave. Chain, huh? I've told them all, well, Craig says I'm not allowed to leave, but I told them they're not allowed to leave, so.
Oh, okay. That's the plan.
But,
right.
You know, I mean, as you said, like, I feel like my team, it's not just the three sitting here, right? And it's Fred and Valerie back in admin, and it's everybody that works at every level in each of my divisions. They know their stuff. Like, I am so blessed. I'm so lucky. We are so lucky to have people who are so dedicated. And, you know, we have people who have retired. We have people who worked here for 35 years. They're retiring. And so there is a succession plan, right? It is figuring out who, and quite frankly, sometimes that means bringing somebody from outside of the county. It's not always good. The best candidate isn't always like already under our roof. And that's okay, because people, you know, bring in new ideas as well. Yeah. So.
Yep. And lastly, what I normally or have been asking is on contracts and things like that. And I know, just hearing some of your comments earlier, we are working with our logistics department, they're putting in new processes, procedures, and learning the old and making corrections and that kind of thing. So I guess what I'm asking is that whatever contracts you currently have working with our logistics or purchasing department, that we work together so that they can have the best outcome and you can have the best outcome. And then we, the Board of Commissioners, can help in any way that we can with timely contracts, getting the correct and timely RFPs out, as well as, I'm sorry for bringing all that up, but.
No, I'm asking Joe, do I even bring up like that we were a year with our vendor without ever having,
Oh,
yeah.
okay, well,
Things have not always, not everything runs as smoothly as my office. I'll just word it like that,
Well,
right?
and
Like,
we have our new procurement director sitting back here listening to everything you're saying, so.
yeah, I mean, to wait for a year almost, right, for a contract to be executed, even though we were already working with them, was a little surprising for us. And, you know, I think that's a hard part, I'll say, is being the elected official, is I am not the one signing contracts. I may be negotiating. You know, with our vendor, our election equipment vendor, I negotiated extra terms beyond what the state had. I got us better terms, and I'll do that again in the future, but I'm not the one who's signing most of the contracts for my office. I don't have that authority. So, and then putting out the RFP, I have no idea what was put out. What was wrong with that it didn't meet whatever it needed to meet. You know, again, frustrating for us because it's been almost a year, and here we are that we still haven't been able to scan those documents in, so, or those books in. So it's a weird place to be in, that I'm not the signer. I don't see the RFPs before they go out, even though we're giving what those requirements are, you know? So it's kind of a weird thing. I get it, you know, that I'm not signing as an elected, but it's just weird.
okay, well, thank you. Those are the only questions I have right now.
Okay.
Maybe weird's not the right word, but.
Commissioner Erickson Galt.
Yeah, you were talking earlier about it sparked my memory. I think it was last year you launched the new program for small scale filers for deeds and other.
Yeah, my prop docs,
Yes.
my baby,
How's
yeah.
it going?
My prop docs? Thank you for asking. You know what, it's still slow. It's not a huge amount that we get in that way, but we do get documents that way. And I think there's still HOAs still don't know that that's an option. And unfortunately, we don't have a registry of HOAs, so it's not like we can tell them. We have some that we know about and we have informed them of. Actually, when I visited our absentee voting counting board, a woman came up to me and thanked me for, she loves, you know, my deeds program and all that kind of stuff. And she does the finances for her HOA. And like, oh, do you know about my prop docs? And you know, can use that. So always trying to educate people about it. But, you know, I think to me, the best compliment is that other people have replicated it. And again, it's not getting like the highest use, but it is being used. And again, that's another electronic, right? Another online way that people can save time from having to drive down here. Or, I mean, I think the first document we got through that was an attorney in California. I think he was on vacation or something, right? So he was on vacation in California, but you know, attorneys, you never, right? Just like elected officials, we're on the clock 24/7. So, you know, he used it to submit a document.
Mm-hmm. Anybody else with questions for the clerk? I was just looking at your charts, which I know you aren't
charts.
using.
Okay, yes.
But it says in your revenues, so fiscal year '25, you got $63,000 in state grants.
Oh.
'26, it dropped down by $40,000 to $23,000. And then for '27, it's projected to go to $41,000.
So 41 is what we got this year.
Okay.
That is a specific, so we have more than one grant, but that grant specifically, because remonumentation is a grant too, but specifically this is for our e-service center. And, you know, we don't have control obviously about how much the state court administrative office gives us in that grant. It's been a wonderful program. We're continuing it. We're hoping to expand it. I've talked to Lakeshore Legal Aid about perhaps doing a partnership down the road. So, I mean, but the 41 was this fiscal year. So,
Okay.
and I think with the 21, they had split it up, right? They had split it up. Remember, it was like almost like a supplemental.
They went to,
They changed the timing.
terms of the contract.
Yeah.
And how they were doing it, so it was this.
Can everybody hear her?
No, we need a mic for her.
She loves it.
It's right behind you.
I'm so glad you're here, Jenny.
Thank you.
Oh, although she has to leave because she does have at 3 o'clock. Okay.
But, no, they changed the way the grants worked and how monies were sent in to the different courts. So they kind of finalized one grant and then went into another within the same fiscal year.
Yeah,
So
right.
now there are only one grant per year, and we also had a tech grant aside from the self-help center grant. So there was 2 different things that happened with those.
And it's changing to now be reimbursement.
Correct.
So
there's like
how that
4
money, how we'll be
changes,
seeing that
since
money
we
now in the
started.
future
Correct.
will be different, that now it's reimbursement instead of us getting,
Yes.
yeah.
Just direct,
Yeah.
okay. Thank you.
Okay, she does have to go. Do you have to go?
Anybody
can go.
have
It's
any
okay.
other
Thanks.
questions? I just want to clarify from what you told us that in terms, you have some serious, it seems like, facility issues. You know, every time
I
I
would
see
agree with
you,
that, yes.
every
I would
time I see you, you remind me, which is fine.
I'm going to
And I
keep it till I
have
get.
air quality, water quality, and fire suppression are all topics that are open-ended for you, and you're not comfortable with where you're at.
And I would say, I don't know if I want to use the word redundancy, but backup, generators. Again, our phones, in the last couple of years changed to VoIP here at the county, so they are connected to electricity, right? And when we lose power, the phones stay on for, I don't know, a short period of time, maybe 10 minutes or something. Somebody else maybe has the number better than I do, but it's not indefinite. And, we have lost power here. We continue to function. We don't close because of that. We only close when we can't breathe. So people need to be able to call us, and we need to be able to call customers. So, and then of course our computers and all that kind of stuff. So I know that there is talk about that, but I would be remiss if I didn't include that as well.
It's okay. It's not really the purpose of the finance committee and the budget reviews,
Yeah,
but
I
it
know.
is, it's like, in a way, it's like public comment. It's a place you can come.
Well, and I want you to
Express
be
your
aware
issues.
of like possible expenditures coming, right? Coming
right.
to you, that you'll know why. I mean, I
Correct.
hope they come to you, and now you'll know why,
Right.
right?
Right. So, I don't know how, well, I can talk to the chair about this, but I do feel like, we've heard about fire suppression now since I've been on the finance committee, which has been like 6 years. And there are a few of these issues that I'm hopeful, as we're realigning where all our people are, you guys are staying here. So we
Right,
need
right.
to make sure that what you end up with is quality
Yeah, I
in
mean,
terms of a facility, so.
yes.
All right, we'll have more of those conversations, I'm sure, and our EDI chair over there is making notes, I can see, so. I mean, we're not gonna solve this for you, but I appreciate that you came in here and told us.
Well,
what
thank
your
you for
issues are.
listening.
You
And
know.
whatever you can do to assist with this, I would appreciate it. So, yeah, like I said, my team works hard, and
Yeah,
I can't ask them to sacrifice their health to do their job, so.
correct. Is there anything you need from us before the November election in terms of support or, we're all nervous, but you did so well in the
What are you
primary.
nervous about?
You're gonna make me articulate.
No, I mean, we're good. I also, I guess I should give a shout out to everybody who does sign up to work for us for our elections, whether it's for us or for our locals. Anyone who works our AV County Board and hears me come in, and I always say, democracy is a team sport. I thank them for being on the team. We can't do it without all those people. And we're grateful, we're lucky that we have enough people who do want to work for us. So, in fact, some people are mad when we don't hire them because we don't need them, but we're lucky. But if there is somebody who does want to work an election and we're full up, I want to remind people, you don't have to work in the community that you live in. You don't even have to work in the county that you live in. You can work anywhere across the state. You do have to go through a certification training, but you can work anywhere. So if your clerk is all full up, that doesn't stop you from working somewhere else.
Yep. And
Commissioner Taylor has a question.
Yep, thank you. Since you're there, I was going to say, you want to talk about the travel clerk going to visit different locations, how that went, how is that going?
Our
Was
local
it-
office visit?
Yeah, the reception that you received when you were going out?
Yeah, I will say, there are many months that we don't do them. In the winter, I try not to do them because of snowbirds, and usually it's seniors that we're trying to, help, that they don't have to come here. The people that we do help when we go to a local office visit, they are just so grateful because to not have to come here and navigate the building. And where were we before? At the library, and people were like, oh, what can I get? Like somebody, they wanted to get, she came, can I get my birth certificate? I said, were you born in Oakland County? She said, no. I'm like, I'm sorry, we can't help you. You have to go to the county where you were born. And so she was so anxious to try and think of something that she could get from us while we were there, because she was so happy that we were there. It's, again, it's about accessibility. Some people aren't comfortable going online. So, we're bringing the services to the people.
Okay, thank you.
Appreciate that. Well, if there are no other questions, I think we will close out the session for the clerk. Thanks for coming in today.
Thank you.
Great work. We're proud of your office and all the good stuff you do, and you know where we are if you need us.
Thank you.
Thank you.
And I'm leaving the clicker on the chair for whoever does this slide.
Okay. All right. If everybody's ready to keep going, I think we've been here for 27 hours today, and want to just push through if we can. Next up, we have our health department. Health and Human Services budget hearing. Hi there, and congratulations on being named a
Thank you.
top health official in Michigan by Cranes Magazine. That was pretty good.
Thank you.
I looked at that picture. I said, I think I know her.
That was my baby picture. That was
Yeah,
I don't want to be.
I
I can hold it. Yeah, that's
Why
fine.
don't we move forward?
Okay.
Do your best to stay as close to this as you
Okay.
can, even if you're turning to talk to the
Okay,
chair.
okay,
If you want, I've got a handheld mic for your other speakers.
okay.
if you-
I think they're gonna step up. That'll be fine. I'm gonna back up and step up. Yeah.
Just be careful not to set anything
Okay.
on the buttons because it might move your slides.
Okay, can I move this over just a tiny bit? Okay. All right. Good afternoon, everyone. Well, we always like to go last. We went last year, and we're going to go last. I think we're last, unless you rearranged it a little.
got
Oh,
one more
second
after
to
you.
last. Oh, you had to move one.
Yeah.
I got a higher position. Okay. All right. Got it. Well, I hope we're going to wow you today and offer some great information. So I do want to take a minute and introduce the team behind me. I say that some of the most powerful ladies in Oakland County here. So we have our health officer, Kate Guzman. We have our neighborhood and housing development officer, Khadijah Walker-Fobbs, and our budget manager, Stacy Sledge. So yeah, amazing team. And I'm Leanne Stafford, Director of Health and Human Services. So I'm gonna go through this, but our friends at Fiscal Services are going to be here to help us with this one. But here you can see it's just our budget and our actuals. We do everything possible, obviously, to try to match our budget. We call it our hypothesis, right? Because we're all scientists back here and try to get that budget as close to what we think is actuals. But I think the thing to remember more than anything around public health is we never know what's coming down the line, right? So in just a couple of weeks, right, 30 days, Cyclosporidium, right? You all know about bag lettuce. We have a funny picture in a second. Salmonella in the jalapenos, right? Legionella in the county. I mean, we don't know. We can try to anticipate, but many times we can't decide or see what's going to happen in the future. So sometimes our budget looks a little bit different than our actuals. The next here is our department revenues. Want to talk a little bit about, we do know in 27 we're going to see a reduction in some of our state funding. They've already actually notified us. It hasn't been impacted as much as we expected it to be. So we've been very thankful in the past couple years that we have not been impacted the way we expected. We know there's going to be Medicaid cuts, right? So we know our services are going to be needed even more moving forward. So we are planning for that. We did in this budget in 27 increase some of our fees. So I want to take a minute and just kind of touch on that. The way vaccine billing works is you can bill for the actual vaccine, right? The medicine that goes in your skin. And then for each vaccine that you receive, you can charge a fee for that. And insurance pays a good penny, right? About $25 a piece to do that. And so many of our clients actually have insurance that we want to ensure that we're getting that full reimbursement back. But what we also ensure is that every person that walks in our door, if they want a vaccine, regardless of their ability to pay, they do not walk out of our health department without receiving that vaccine. So if they can't pay $25, if they can't pay $5, we are going to make sure they receive that vaccine, and then we're going to make sure that they receive all the services that they need. What we will work with is if they're not on insurance, can we get them on Medicaid? Which you're going to hear me talk a little bit about Oakland Connects today, and that is what our team does, right? Our Oakland Connects team, above many things, they also look to get people on insurance and Medicaid when necessary. We also are looking to increase our food license fees. So last year, we started looking at what we charge for our food license fees. We were significantly lower than the counties around us. We had not charged or increased our fees for years. And so we did a cost analysis on what it cost us to do the service, and we were not even close to what it cost the service. So we took a 3-year plan. So last year we increased 15%, and this year we're increasing 7.5%. We're following the union contract, right, that shows the increase in fees. So next year we'll be bringing it, and it'll be 7%. So we're still significantly lower than what it costs us to do that service. But we do feel we need to get closer to what it costs. So you're going to see we are using some of that cost to ask for some positions, which I'm going to talk about in a second. And then lastly, rabies vaccine. 2 things here, right? If you get bit by a bat, you need rabies vaccine, regardless of your ability to pay. But what we have done a very good job with is figuring out how to bill for it. Insurance companies will pay for it. So if somebody needs the vaccine, they can bill for it. We didn't bill for rabies vaccines in the past, so we just let people come in. It is an expensive vaccine. So our team, our billing team, we actually have a billing team of about 3 people, have found a great way to get that billing done and it paid for. So we've basically increased our revenue in rabies vaccines. Now, somebody comes in and they can't afford it. Sometimes it's a family of 5, right? We will give that vaccine for free, what they're willing to pay or their ability to pay, not willing, ability to pay. The next one here is expenditures. We always try to use all of our money. We call it budget Tetris, right? Like, especially when we know, as I talk about, we don't always know what's coming down the line. If we know there's something coming down, we try to make sure that funding will have the money, and we don't have to come back to the board and ask you for additional money to try to cover that. The next one is department, I think this is the same. Is this the same? Which one am I? Adopted budget. I'm going to keep going on this one unless you'll have questions on it, and I'm just going to point at Brent when that one comes up, right? My friend Brent over there. So the next one, I want to talk about personnel. I know this sometimes is when you look at the picture here, it's different than what we see. I think these numbers that you see up here were taken in February, which we have a lot of summer students that are shown up here that don't come, college students that don't come to us until the summer. We have over 15 summer students that come and just help us with beaches, which we're going to talk a little bit about our beach program in just a few minutes. So a lot of these unfilled positions or vacant positions were some of those summer positions. But what we are asking for, I talked a little bit about that revenue coming in, and by deleting positions. What we try to do when somebody retires or leaves a position is, what do we need? What's the priority in Health and Human Services at that time? Sometimes it's in the Health Division, sometimes it's in Neighborhood and Housing Development. So we look at that whole picture and say, what do we need? And so sometimes it's not the position that just left, right? Sometimes we need more nurses, right? And so we really try to look at that whole picture and decide how we're going to move forward with that. So what we've done is we're deleting a few positions. So we're actually deleting a full-time nursing position, a public resource coordinator, and 3 part-time hearing and vision techs. And we're using those savings as well as the new revenue coming in to create a environmental health senior sanitarian that's going to help us with lead testing and investigations, and I'm going to hold that off for Kate to talk about. We're also doing FTE auxiliary health clerk to help process the paperwork. We are extremely successful around our lead testing right now, and that is so important for kids under the age of 6. But we need some help getting the paperwork in. It's very important. The next thing is we're going to hire 2 additional community health workers in Oakland Connects. Oakland Connects has exploded. It is amazing. We have seen helped over 10,000 residents since October of 24. And this isn't just somebody that needs help for one service. These are complex cases that need housing, they need food, they need transportation, they need mental health support. And not just one of those, many of them need all 4. And so our caseload is over 60 a person right now, each of our community health workers. That's not easy. And like I said, very time consuming, right? And we spend lots of time with each of our clients, and it's important. So we're asking for 2 additional community health workers. Khadijah's going to talk about our winter shelter plan. All of our community health workers spent 100% of their time this past winter just on housing needs. It was incredible to see the amount of need in our community. And so those 2 additional community health workers will help with that need. The other thing we're asking for is a communication and marketing specialist. We all know what social media can do for people, right? And so we need help getting social media out for both our health division. Let's combat some of that social media that's out there about vaccines, right? We all know we need help getting word out about things like cyclosporidium. And so we're asking for a communication and marketing specialist to help us get that word out. And lastly, what we found for hearing and vision techs is that full-time employment is easier to find. We struggle finding people that want to come in and work part-time in the schools, but when we actually hire somebody full-time, they'll come in and then they work through us all the way through the school year, and then they also help with hearing and vision tests in the summer. A lot of times kids will miss in the school year, but they still need to be tested in those age groups. I'm gonna let Kate talk about that as well. And so those individuals help us do outreach in the community to get those individuals tested. And follow-up. I think she's gonna talk a little bit about follow-up too. So those are the positions that we're asking for. The other thing I wanna mention that I'm incredibly excited about is senior services. I am so excited about senior services coming over to Health and Human Services. So we used to have a senior services program. I've been asking for a while, can we do senior services? And so I'm very, very excited that starting, as long as you approve it, October 1st, senior services is coming over to us. So it looked like we had quite a few vacancies, but I do want you to know this, so we put this together. Currently, grant vacancies. Our grant vacancies are really just based on the grant funding that we have available. So a lot of these grant funds either we're gonna have to delete these positions because the funding isn't available, or we have a few that are posted currently that we're looking for positions and their grants. So 7 of these are not posted because of grant funding. 3 are being posted in the next 30 days. Those are Oakland Connects. That's the Bomber grant that we're looking to post those. And 1 is we're waiting on a funding decision, if whether or not we're going to keep that position or not. The general fund vacancies, 13 of the 17 are posted, so we're actively looking. 2 are being posted as we speak. We just got the asked for the approval, and actually we hired 1 today and another one was hired last week. So we have these positions pretty much wrapped up, are being posted as we speak. I do want to say that because of what happened in January and February, we held posting positions, especially some nursing positions and some WIC positions, because we didn't know about federal funding. So some of this is us just kind of catching up from hiring, because we put all hiring on hold. If we thought we had to let anyone go, we didn't want to have to do that, and we wanted to have positions available for people if that became the case. This one I'm going to pass to Brent if you all have any questions about, but a lot of our federal funding obviously is neighborhood and housing development. We don't get a lot of funding from the health division through the federal government. We do get some pass-through that generally comes through the state, like WIC, but overall, currently we're hearing it's all stable for this year, which is good to hear. Again, we have a small cut coming in the health division, but overall, the revenue and expenses are pretty stable for next year. I think you've seen this slide before. I know Barb talked about it, so I will just kind of gloss over it. When Mediha came, and lucky enough to get Mediha as our leader in our areas, we kind of worked together to come up with these 3 guiding principles. So how do we demystify the government? How do we get people to know about the services we have in Oakland County? That is Oakland Connects, right? I mean, they talk about every single service and connect people to every single service. How do we build capacity? Not just for us, but for our partners, right? We cannot do this alone. We have so many partners in this. And so how do we build that capacity? And overall, how do we improve user experience? How do we, when that person walks through the health division, starting from that clerk that's sitting at that front desk, that might be the only interaction that that client has with the whole county government, and we want to make sure from the time they walk in for the time they leave, the experience they have is amazing. And so we're working on that every day. Our next thing is our strategic plan. I will say, being at the health division, 26 years, we have always had a strategic plan, always had it. Did we implement it all the time? Not always. So we have done what we're trying to do and done a very good job over the last few years is we developed a strategic plan that we knew we can implement. We tried to put things in the strategic plan that made sense, right? They were activities that we knew we can accomplish, and we're actually tracking them. So we're working very closely with Henry and his team in Performance Management Office. Actually, I think I talked to you almost every other day, I think. But what we did is we really focused our goals on our 10 essential services that we do in public health, right? So there's 10 essential services in public health, and I think Kate's going to address a few of those. But we align our goals with that, our guiding principles, these goals, and then we also use our blueprint to end homelessness, right? Goals and objectives, as well as our HUD consolidated plan. That drives what we do every single day. And so we're always tracking. So we're working with Henry and his team. I do that all the time, sorry. We're in the KPI collection phase right now because our strategic plan has been created for some time. So continuing to work with their team to make sure we meet all those goals. Again, I mentioned Oakland Connects has helped over 10,000 residents, and that's through 2 ways, right? We have community health workers that are on the ground every single day, out at outreaches, available on the phone, meeting people where they are in their homes if they need to. And then we also have the phone line, which you all are familiar with, Nurse on Call. What do we call them now?
Nurses of Oakland Connects.
Nurses of Oakland Connects. We're always trying to find a way to make it kind of fun. So, because they're still nurses on the phones, right? You still, when you pick up the phone for that first call, we find it really important to speak to somebody when they call, right? What kind of questions do you have? We're going to start with a real person. The next thing I wanted to talk about is the Oakland 360 Care Center. We talked a lot about this. We've had some grant funding that came from the state. It has taken us a while to get it up and running, but the exciting thing is now we have 2 locations. So we have our Pontiac location, and now we have a Hazel Park location that we're working with Corktown and some partners in there. I do want to tell you about a really cool event, inviting all of you all now. We'll make sure we follow up with Michael and team that on September 10th, Herman Moore will be coming to Corktown for us to do a launch of the Oakland 360 Care Center, and all of you all are welcome. He's going to sign some autographs, take some pictures, and he's done some really cool. I'm really looking forward to the PSAs that he recently did with Executive Coulter, and so those will be coming out very soon. Language access. So I know everyone is excited about the results of the language access policy or project that we did. We are going to be bringing a draft policy and plan to the board very soon. We're wrapping the draft plans up now. And then we'll also be working with Henry and his team about implementation. So we're going to be bringing those recommendations to the board very soon in the next couple of months to talk about what next steps are. So really excited about that. Our Welcome Oakland team, along with Henry and his team, have been working very hard on that. I'm going to go back one more. I know the treasurer's office and Jill Robinson talked a lot about this, but we're going to kind of share a position with the land bank and neighborhood and housing development, really around building capacity, right? And so the 2 of us are going to work together to support day-to-day operations, including community engagement. And that just doesn't include our 2 offices, right? That's all of the housing providers. I know you all hear from the housing providers quite frequently, and so our goal is that we're all working together to try to make sure that we can develop and preserve affordable housing, and then really look at things like a visual eye to really see what's out there. So we'll be working closely with them as long as you all approve that position. So next, I would like to turn it over to Khadijah Walker-Fobbs. She's going to walk through the neighborhood and housing development projects. Oh, that's yours.
Thank you. Good afternoon, everybody. Thank you, Leanne. Okay, so as Leanne stated, what we do every day is really driven by our consolidated plan and the goals that we follow and keep in front of us at all times, and our strategic goals that are tied to the blueprint to end homelessness. So I'm going to just highlight a few points because there's a lot of crossover. You'll see that the strategic goals for our blueprint to end homelessness address first preventing the root cause of homelessness, and our consolidated plan focuses federal funding on increasing and improving homeless service, shelter, and prevention efforts. You'll also see that we're highly focused, and I can't wait to talk a little bit more on increasing affordable, quality housing here in this county. We also have responsibility for providing public services and expanding economic opportunities that will help our residents with safety, food access, and other assistance through a lot of our community development grant project funding, as well as the administration for those types of projects that go out to our cities, villages, and townships. And so I want to just highlight some of the focus areas that tie back to our goals and plans. And so one of the things that you all know is that we established our Housing Trust Fund back in 2023. And through the work of the Housing Trust Fund, which is focused on the affordable housing development, we currently have over 1,600 units in the pipeline in various stages of development, some completed, some under construction, and some that have been approved. And so we're very, very proud of that pipeline. We also, by 2027, had a goal to increase our shelter capacity. And so thank you to you all in our executive office with the funding that we have received and braiding it with our federal funding from HUD. We currently have underway 150 units that we have approved investment in that we expect to come online in the next several years. We also have invested in, as Leanne shared at depth, our Oakland Connects resource line. We know that one of the gaps that residents were facing, and that even our elected officials at the local level, people would call, they just didn't know where to go or what the pipeline was if there was somebody seeking shelter or who needed housing supports. And so with our launching of this resource line, which this winter was our first year doing that, we've been able to provide after-hour assistance for the first time in this county. When people called at 8:00 p.m. on a Thursday, somebody could answer the line and provide supportive services, and our focus was winter months, with it being the coldest. We've also been able to partner closely with our health team and our health partners locally here in the county with Wellness Wednesday every week. I'll talk a little bit more about that. And part of that is part of our overarching strategy for outreach and making sure that residents know where they can come on site to get services each week. We also distributed 1,000 empowerment coats, so thank you for the approval of that. Those coats have gone out. They are stuffed with resources in the pockets. Our workers and our nonprofit partners distribute them to people as they need, with socks, warm items, and also cards to say this is where you need to go to seek services for behavioral health, services for food. That is also part of our strategy of making sure that we don't leave anybody behind. All right, next I want to just share a little bit about what we were able to do around homelessness supports. I know this is a priority and focus for all of you here in the county, and I thank you for allowing us to have our Oakland Connects housing coordinator position that was approved last year. Through that position, that individual has been able to assist with building out the shelter infrastructure, prevention, and supportive services this year that I'm going to talk a little bit more about how we've been able to utilize. This individual's also created a toolkit, so we're very excited. This toolkit is launching this month, actually, around emergency shelter development. The whole point of the toolkit is to go into local communities, to work with our nonprofit partners, and help explain ways to set up pop-up or emergency shelter overflow when we know a lot of cities have been coming to us and saying, hey, what do we do? How do we help? How do we make sure we're in a position to assist people as needed when it gets cold? We were able to establish protocols, as I talked about, for after-hour shelter. But this winter, we were able, with the $200,000 approved by the BOC last year and the $150,000 put in the budget in Health and Human Services, 376 people were placed into emergency shelter overflow just between December and March. So that's huge. That's not even our normal shelter capacity. That was just the overflow of people that we needed to place. You've heard us share and highlight at the State of the County New Birth in Pontiac, where we had 60 beds for just women and children, and that spot stayed filled the whole season. And we were able to place many of those mothers and women in housing as the season warmed up to spring. Over 500 people were assisted through Oakland Connects housing line just around shelter and housing. So that is not even encompassing the other 10,000 calls that Leanne stated earlier, but that was just people calling within about 12 weeks for housing and shelter support. Now, we know that when we talk about shelter, we have to talk about what is our housing pipeline. And so I'm really proud and pleased to share some updates on what we've been doing as we invest in the pipeline, from shelter, transitional and supportive housing, all the way to affordable housing and market rate units. In September, you all approved $1.3 million in the budget, where we were able to allocate those funds towards a new development that's been approved in Royal Oak for 45 units of affordable housing right in the heart of downtown. This still has not closed yet, so we're very hopeful that in the next several weeks we'll be able to close, but that funding has been held and allocated to bring more affordable housing online in an area where it's really hard to get land and it's hard to be able to build affordable housing. We also used our annual $2 million appropriation for our overall pipeline, and so those funds have been used in conjunction with our federal funds through the Neighborhood and Housing Development, plus our Housing Trust Fund, and that is how we have 1,600 units, as I stated, of affordable housing that's in the pipeline right now as we speak, and will be in various stages of development over the next year. We've also been able to renovate just this year 302 units of housing and keep our housing stock that we already have built functioning and stable and safe for residents, and so that's very exciting. We have currently 24 housing developments, as I said, in various stages, you can kind of see, And with those units, it's really important to highlight that 30 to 120% of the area median income are the targeted amounts of income levels for families that we're being able to serve. It's also really important to highlight that 981 of these units are supported by project-based vouchers. And that's really hard to have that type of pipeline because those vouchers are what people coming out of maybe homelessness or housing insecurity are able to go into to help pay their rent until they can keep earning more and getting their family stabilized. I'm also very excited to share about the diverse housing types that we've been able to bring on, and I hope that some of you will be able to join our bus tour that we are offering next week for our BOC members. But we've been able to invest in neuro-inclusive communities. Oakland County is the first of its kind outside of one development that was in Washtenaw to bring a neuro-inclusive community concept and funding. And so right in Rochester Hills, we have 2 developments underway. They'll be part of the tour that will serve those who have intellectual and developmental disabilities with deeded properties that they will have ownership in, along with regular market rate housing. And so this is very exciting. It's been covered a lot in Cranes and many other spots. We also just closed on our first transitional house for youth aging out of foster care. This is the first time that we've been able to invest in something like this, and so we're very excited. This is a model. It's going to be a way to show what is possible when we use our funding in creative ways, and it will support young people aging out so that they're not seeing us later down the pipeline at a shelter. We've also been able to invest in some really amazing workforce development housing. And so in Pontiac, I know that one of the units we've developed, 111 Oneida, has gotten a lot of press. It's a beautiful restoration of a 100-year-old building. And it's going to bring over 50 units of workforce development housing to serve families right here in Pontiac. And it's also restoring a gem of a building that needed to catalyze the neighborhood. And so with that, you can just see some other pieces. We have $45 million of investment. We've leveraged $424 million. It's all very, very impressive work, and it's all part of the ecosystem for housing. Since the integration of housing and health under the umbrella of Health and Human Services, it's also brought some really great synergies, and I'm going to allow my colleague Kate to share more, but we've been able to apply jointly for grants, lead grants especially, and I know she'll talk more about that. We can do the abatement work to help families and residents throughout the county while the health team does what they do with making sure families are supported, and she'll talk more about that. But with that, I'm going to hand it over to Kate to talk more about that side. Thank you.
Thank you, Khadijah. And I'm terribly sorry that my back is to all this setup. It bothers me a lot.
Everybody has that issue.
I know, like I wanted
we want you to
360. Good afternoon, everyone. Imagine trying to restrict health into 3 slides, so I will do my best. We're doing a lot at the Health Division. But the first slide is just a reminder to you all that in the state of Michigan, the Public Health Code defines the core essential services that local health departments are responsible for providing. And the state funds through our local comprehensive agreement help support these services. This slide just highlights 18 of those services that are listed as essential mandated services, but what's missing from this slide in the title is providing 18 mandated local public health services and much more, exclamation, 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 because this is just the tip of the iceberg. This is just a snippet of what we're doing. But I think it's important context to the conversation to remember that all local health departments are mandated to provide these services. The Health Division strategic plan aligns with these 10 essential public health services. And I know we had a slide previously, thank you, Henry, that outlined our strategic plan with the 10 goals. I don't have a slide that showcases them all because, again, I'm limited to 3 slides, so I'm just highlighting 2 goals today. Goal 2 is to investigate, diagnose, and address health problems and hazards that affect the population. And 2 programs to highlight specifically that fall under this goal are childhood-led and hearing and vision. Childhood-led remains a priority for the Health Division for fiscal year 27, with the lowering of the threshold for elevated lead levels and application of universal lead testing at age 12 months and 24 months, the workload of our team has increased dramatically. We're passionate about this work because of the lasting impact on children's health and development. Lead poisoning dramatically impacts high school graduation rates, which then just leads into a cycle of poverty that we're committed to break. Lead poisoning, again, is a priority for us. With a very small lead team, with 2 nurses and an auxiliary health clerk and a small team of sanitarians, we've been able to change the landscape of lead testing in Oakland County. We're heading out to pediatric and family practice providers. One of our nurses has visited 75% of all of these providers in Oakland County, educating the providers and their staff on the universal testing legislation and the recommendations for follow-up. The nurses are doing case management where they're visiting children that have elevated blood lead until those levels are stable, until that levels drop and that family no longer needs their assistance. In terms of testing, if you remember from last year, one of the issues that we really faced was we get a lot of capillary tests where we poke a child's finger and it's a screening for a positive, but what we really need is a venous blood confirmation to actually say that this child has lead poisoning. And where the county and the nation, to be honest, was struggling was that link from the capillary testing to the venous testing. With the introduction of an auxiliary health worker, we've been able to test 59 children in-house, which is eliminating one barrier for those families. And this is just with one simple staff person who is embedded in WIC, which has been an incredible outreach initiative, and also at every community outreach that we can possibly send them to. In terms of our collaboration with neighborhood and housing development, this has been even more exciting. One of the barriers outside of venous testing that we really found for families is that they were hesitant to welcome our team into their homes because they knew that if they had a lead problem in their home, they did not have the financial means to fix that problem. So rather than welcome our team in and troubleshoot with them, they just refused to answer our calls, would not let our team in to do the inspection. Now, with 2 separate grants that we have with NHD that allow for remediation and abatement of lead, we can say to families, your child has lead exposure. This may be from your home. If we come into your home and we find the source of lead, we can help you get rid of it. And that's just been life-changing for 17 families that we've already helped this year. Our lead program position requests. Yes, just to highlight, I know Leanne mentioned it, but what we have asked for this year is an additional sanitarian to do the lead inspections and the auxiliary health clerk. From part-time to full-time, we're requesting that full-time position, so we have someone available to do those venous draws and process all of the paperwork, as Leanne mentioned. Hearing and vision is linked in on this slide because I wanted to highlight that one of the outreach initiatives for the health division this year is to bring as many services as possible to every community all at once. So when we are headed out to do hearing and vision in every community, which we do, we are also bringing lead testing, vaccines, education on early childhood development, education on safe sleep, breastfeeding, every service that we can compile into an outreach initiative, we are doing so. With hearing and vision gives us the capacity to touch thousands of families. If you look at these numbers, 52,962 children were screened for hearing in the last school year. And the follow-up for that is the important piece, because 2,100 of them were referred for follow-up, meaning they failed their initial screening. And our team worked with those families side by side to get them into care. 151 of those were diagnosed with actual hearing loss and are in care with the services that they need so that they can live a healthier life. 69,731 were screened for vision, and out of those, 1,300 were referred for follow-up, and 343 were diagnosed with loss, and they're in care currently. The touch points for hearing and vision are enormous, and now we are capitalizing on that opportunity to talk to families about all of the other services that we provide at Oakland County and at the Health and Human Services. The position requests for hearing and vision are for a full-time hearing and vision technician. And as Leanne mentioned, the SAR attempt to work on recruitment and retention of these positions, hoping to retain them throughout the summer and utilize them as in a different way at outreach events so we can continue their work all year round and not just during the school year. What would a health department slide be without bagged lettuce? So goal 2 is to investigate, diagnose, and address health problems and hazards affecting the population. This slide is not specific to a budget request or a funding request. It's my chance to highlight to you what's on my mind on a daily basis. On Thursdays, I spend my mornings with our epidemiologists in our communicable disease meeting. And my notes from today, this is very fresh data, my notes from today are that in terms of Cyclospora, we have 1,498 cases that our team is actively investigating, either closed them out or currently investigating. The age range is between 9 months to 95 years old. What we're also working on today, this is all my notes from today, handwritten. You're getting hot off the press. Ebola traveler monitoring, a Hep A cluster, animal exposures galore, a measles case that bleeds into our county, an increase in chickenpox cases, Candida auris, CPO, which is carbapenemase producing organisms, swine flu, and vaccine hesitancy as an epidemic. This is all in a 1.5-hour epidemiology meeting from this morning. This is what we're facing, and this is what consumes my thoughts when I am trying to fall asleep at night. The final slide, goal number 6, utilizing legal and regulatory actions designed to improve and protect the public's health. This is my thank you to you all for expanding our beach program. Oakland County is such an amazing place with so many beaches. Imagine that we are now monitoring 251 beaches on 123 lakes. These are public and semi-public beaches that our team is monitoring. And I can't thank you enough for adding 145 beaches on with the expansion of the beach testing that you funded. We were able to hire 8 additional staff to do this work. And as a result, we've had 53 beach closures so far due to elevated E. coli in the water. So we're really keeping residents safe.
Are you getting positive feedback from that or negative? I mean, I wouldn't be happy if the beach at the end of my street.
I was going to say that residents are typically not happy when we close their beaches, especially when it's around a holiday weekend.
Right.
But it's so important. I mean, I'm used to being not very popular.
Okay.
That's our final slide.
And we can take questions now, but these are true, the heroes of the health division, right? We have over 400 employees that do a plethora of work every single day. And so we just wanted to show you what some of their faces look like. So,
Awesome.
yes.
All right, well, I will open it up to the commission and start with Commissioner Gershenson.
Thank you. During this grueling budget hearing week or two, I've been looking forward to your presentation because you're my favorite department.
Thank you.
And I mean, from Mediha all the way down. It's the thing I love the most is that we can come to you with any idea and you just don't dismiss it. And we kind of try to find a way to make it work. So I have a new challenge for you. We've been having a lot of trouble finding some legal aid for immigrants. And our Angie Powell had the brilliant idea of maybe we can do something through Oakland Connect. So I'm gonna charge you with that to get back to us. And also food resources. Now, I know we do a lot. And I'm also thinking maybe there's room to just add a little bit more through Oakland Connect. So I'm charging you with both of it because we've been asked about that repeatedly, and it would be great.
Please listen to public comment because we
did.
get every public comment.
It would be
we
great.
listened to
I mean,
today,
I
so.
know Oakland Connect has expanded and it's fantastic, and this seems to me like maybe we can do something together.
Challenge accepted.
Okay, good.
Right.
And then I just have to shout out the work that Khadijah's doing. This is probably one of the most impressive problems we have, and as we're going into the winter, we're aware of it, and her openness and honesty and sincerity about working on this problem has been great. So We're hoping that we can add a little bit of resources to all your efforts, but we do appreciate, on behalf of all the residents of Oakland County, all the work that you've done.
Thank you. Thank you so much. Thank you.
Anybody else? Any of the other commissioners? Commissioner Spiz.
I can't skip a meeting without making a comment. So enjoyed the presentation, thank you very much. And I want to give you some kudos for your goals and objectives. So I know a lot of the others that have come in here just throw their goals up there. And my first question is well, how do you measure that you're going to meet that goal? How do you know you've met it, right? And me and this young gentleman have talked many times after that, and I see that you have a lot more detail behind it, which I can appreciate. But I also made the comment, we still have a way to go so that we can actually truly measure
Agreed.
if we're successful or not. So I appreciate a good first step, but we have some work to do. So thank you.
Agreed. Yes.
Thank you, Commissioner. Commissioner Erickson Galt.
Yes, I just want to raise up Oakland Connects. It is one of my favorite things. I'm chronically online seeing what people in my district are talking about, and I frequently get people posting, I'm being evicted, I'm having trouble finding a new place, and Oakland Connects. I was out knocking doors for a candidate, and I typically always end my conversations with, do you have any issues or concerns? And I expect them to talk about, taxes or whatever. This lady says, I need help around the house. And I thought, Oakland Connects. I don't know if you can help her, but you can tell her where to go to get the help she needs. And I just love having that ability to tell people in my district or anywhere in Oakland County, if you need help with anything, call Oakland Connects. If they don't have the help, they will help you find the help. Yep. And that's great. Yep. Having, just a general helpline for people who are in need is just wonderful. And Kate, I loved your work. Seeing you on TV during the water main break crisis.
Agreed.
The reassuring voices, we're going to keep you safe, we're going to keep you updated on when you can drink the water and everything again. That kind of, we don't always see that. And it was great to be able to lift you up and say, we're doing good work. We are protecting people. As you said, you have mandated things, but you go way above and beyond that. So thank you.
Can I add to that? I think when we were looking for both Kate and Khadijah, we wanted two individuals that we felt could get up and speak with sincere, belief of what they were talking about, and we get that with both of them. So regardless of who is presenting, you saw it up here today, you're getting the truth. They're not telling you something that's not true, and that's 100%, which we absolutely love that about both of them. So thank you to both of you.
Commissioner Smith-Charles.
Thank you, Chair. I was curious, as we all know too well, about reimbursements. And so I was just curious with your impact of federal grants on the budget. It looks like 31% of revenues is federal grant, and then expenses about 17%. What would be an example of expenses, and where would reimbursements fall? And third part to that question is, how long do reimbursements typically take?
So you want to take that one for me? Stacy is our guru of that. So.
Yes. So there's two different types of reimbursements that we get. The majority of it is through our local comprehensive agreement, where most of our mandated services are. The two prominent sources is Medicaid outreach. We get money back for doing Medicaid administration. So our nurses, whoever, when they interact with anyone who qualifies or is eligible for Medicaid outreach, we get 50% of any of the expenses back. And then the other part is we have an STI control reimbursement, and that pays for part of the salary for our med tech in the laboratory. So from that standpoint, and just the reimbursement part, we're good unless there's some changes. The second part of it is through our actual services. It's not a reimbursement, they're one-to-one. So meaning like WIC, it's fully funded. So if anything happens with that, the state would probably not give us the funding or decrease the allocation. So there's two different funding sources. And then, of course, there's neighborhood housing, there's CDB grant, which is fully funded.
Okay, thank you so much.
Okay.
Is that it? Commissioner Taylor?
Yep. I was going to say, before you have a seat, Ms. Stacy, since she made me think about this with the Medicaid, you know, with the new requirements, the working requirements that's coming next year, how will that impact you?
We can probably take, you want me to take that
Yeah,
one?
well, from the state standpoint, we are keeping in constant communication with them. And right now, the states, because they're the ones that provide the funding from CMS, right now they're saying that everything is stable right now, but they will keep us updated if there's any changes.
Okay, okay. So
I'm
you're
going to throw one thing to that, though. So we know that the majority of our population will be, I mean, a big population will be impacted. So we're working with actually workforce development, and we're going to actually do some, we'll call them town halls with individuals, so we can walk through what those work requirements will be, as well as we are hoping to get people recertified before they lose their Medicaid. So we're going to have one-on-one working sessions as well, so that people can come in and we can work. We're hoping to work right with MDHHS, have somebody on site with us to try to do that. So watch for those to come out in your districts. Our goal is to try to do somewhere between 7 and 10 between now and the end of the year. So that's coming.
Okay.
No.
And along the lines, I have to ask again, your succession planning type things. I know you have a lot of stuff in place. I can see in working with all of the people that you have here. I can see a lot of things that you're already doing, but just to hear and get it on record here, please.
Yeah. So I joke that I'm the oldest one, and then you have these two. So, I mean, you're in pretty good hands if I walk away. You know, they're amazing. But I think what we have that we're lucky in Health and Human Services is the dedicated, right, and educated staff that are existing. Again, I think the person in front of us, Lisa, said it very well, right, is that it's not always the person that's sitting in the seats now, but there's external people that are public health people and housing people that are very dedicated, right? And so we talked a little bit about it. As a position or somebody retires, we look within our own agency, right, because there are very qualified people, and then we look to outside, right? Are there people outside that are interested? But our goal is to work, like we have administrators that know all of our programs, right? We have chiefs that know our programs to just know exactly what's going on and mandates. And so we're always looking to offer opportunities for them to be able to learn about the leadership positions and bring them on board.
And along those lines, what I was also listening to here is the documentation, because it doesn't matter who's sitting in the seat, it's the process that the county needs, or the resident or the person that's receiving that service, so that nothing is missed. So a part of succession planning is the knowledge that you have in your head gets documented some kind of way. And that's what I was also listening to here. I don't know how.
Policies and plans, right?
Yeah,
And that's not the easiest, right? Because sometimes they change frequently. I know Khadijah's done a very good job. There was not many policies and procedures left for her, and her team have spent a great deal of time making sure it's documented. With mandated services, we go through an accreditation process. There are lots of policies and procedures, which helps, right? If somebody steps in, and we've tried in the fiscal side of things as well, trying to document things. So if someone else comes in, it's easier to understand. Our partnership with fiscal, right? I think we've tried to do some more of that as well, really trying to document, especially neighborhood and housing development, who does what. So again, we're always working together in that.
And I find that too when you're working with grants. I know you get a lot of state grants and not necessarily federal, but a small percentage, 17 or whatever. But a lot of my auditing hat is processes and procedures, how it's being followed through. So again, that's why I was interested in what your succession planning looks like, so to say. And then also,
Sheets like this.
Yeah. Those ones that make you wear glasses.
Magnifying glass that's there. So.
Absolutely.
Yes.
Also, you deal with a lot of contracts and stuff. How do you have your processes in place to stay on top of those?
Yeah. We do. It's you know what, that is not the easiest, right? We run into times when we have 3 months left on a contract and it's like, oh, we have to go out for RFP. We have, and Stacy currently, she has 3 staff and they handle all of that right now. So we're
That's why I
actually,
told her to stay.
we're actually adding a person that's specific to grants and contracts, right? We just hired her. She'll be starting on the 31st and that's all she's gonna do, right? Because we have a lot of contracts that we deal with on a daily basis. So her main responsibility will be for tracking those and making sure that we're getting ahead of them as much as possible. So.
And you are a fantastic department. We really do enjoy working with you, and anytime we can help, you know, events and stuff, we show up, just because we really do appreciate all the work that you do.
Thank you so much.
Thank you.
Thank you. Thank you.
So is there anybody else who has questions? I have a couple of things. First of all, the 111 Oneida. I grew up in Pontiac. I had a relative who lived there my whole childhood. I have her entire collection of depression glass at my house. But the thing I like about that project is it could be anywhere, any community, but it is really a special building in the city of Pontiac. You know, it is part of the history, and it's so well built and just really something that I'm glad that it's part of our plan to provide affordable housing, because it says people who aren't millionaires can still live in a building with travertine floors and Pewabic tile and all that stuff, right? Because we worked to save and protect that building with the people who wanted to invest the money in the work. So I like that project because it is unique. Recognizing some of the other housing that we're trying to put up as fast as we can and all of that is also important. I think 1,600 units in development is not a small number. I mean, 1 unit at a time. So my question about housing relates to homelessness this winter. We've all been kind of sensitive to the fact that you know, Pontiac's got the folks sleeping on the library steps the last couple of weeks. And I know last year it was kind of a scramble to find some housing, you know, at 5 o'clock at night as the snow is coming down, kind of thing. So what are we doing this year to improve that process and make sure, A, we're touching people faster, and B, are we able to place everybody? So that's kind of my question.
Sure. Yeah, go ahead, yeah. Yes, thank you for that question. So the first thing is that Oakland Connect's housing coordinator position was so crucial. That was approved last year because the sole focus of that individual's role has been infrastructure, manuals, training our local communities and nonprofit partners so that we have the bones to make sure that as we invest in other things, there's an infrastructure, there's a pipeline for people to call, and there's a way for them to get supportive services. We are still planning on opening the temporary shelter, and so we are still planning to move forward with that temporary shelter at New Birth, where we'll have women and children being able to be housed, because we noticed through Oakland Connects and just looking at data that that was a population that we were seeing a great need for. And we also will continue with approval of funding, hoteling people through Oakland Connects, which was really important, because the truth is there's just not enough built beds. So we have to sometimes use other methodologies where if they call at 8 o'clock at night and we have to get them in a hotel, we do that. And we have designed a protocol and kind of manual that we've trained the Oakland Connects team on, where within 72 hours somebody's making contact and working with that family or that individual to figure out what the next pathway is. We just want to get you out of the snow. Now we got to figure out who we're connecting you to, and it might not even be us. It's hopefully one of our nonprofit partners. And so so that infrastructure is in place because of the investment that you all have approved and made. So we do need to continue strengthening it. We are seeing an uptick of issues. I don't think that's a surprise to anybody here in the room, right? Like benefits have been cut. We're seeing, people lose employment. We're seeing the needs continue to increase. So I think we need to make sure we're investing in infrastructure and continuing to make sure that there's a clear pipeline where things are streamlined. I hope that answers your question.
Yes, it does. Related to lead, is that you? Okay. Thank you. So how are we coordinating, I will say, are we coordinating with WRC? Because they have a program where they're replacing lead lines in Pontiac. And Pontiac specifically, but it might be another community too, but they have a big federal grant to replace all those lead lines, and I'm wondering if you're coordinating with them so that the data reflects all of that.
I have not yet coordinated with WRC on lead, but now I will.
Oh,
Interestingly,
definitely.
water is not a source of lead poisoning in our children. From our statistics, it's lead paint chips, it's makeup, it's cosmetics, it's cookware, all internationally imported. And so we have not found water to be an issue in our caseload, but that's a wonderful recommendation. I will reach out to them.
Talk to them because
Thank you.
they're replacing hundreds of lead lines in the city of
That's amazing.
Pontiac this year. So it would be good to see some data that says, yeah, that made a difference, right? Right. And Marcia asked the immigration question, and beach monitoring. I mean, I think we get the report every day, and yeah. I wouldn't want to be you getting the answers, getting the complaints, right? But it's important. It's really important. We're a county of 400 lakes, so. Okay, I think that is all of my questions. We're gonna have people in shelters this winter, and hoteling is a piece of that. Do you have the funding to do the hoteling that you have to do? Did I read that somewhere that we do not?
We do not. Like
that
right
there's
now,
a
we don't have
shortage?
funding for that, yes. So
Okay.
we had tried with the state and we didn't get the money from the state. I try to take some from my budget, HHS budget, but that doesn't cover it, so.
Okay. So that's an open question.
Yes.
Maybe no. Okay. All right. Does anybody have any other questions for this group? No. Okay, seeing none, I will say this concludes the review of the Health and Human Services Department, and thanks so much for coming in, and you can tell you're one of our favorites.
Thank you.
And I really like Mediha's shoes. I don't even think she heard it, but she does. She does. Maybe a 5-minute recess to just get organized, and then we'll see you guys. that takes triple magnifying glass and a lot of time. So thank you to the staff, and then thank you to the fiscal department who sat through all these and answered a lot of our questions and got a lot of arrows thrown at you, but, you know, it's been really important to have you here and able to answer the questions as they came up, so we're really grateful that you were here and spent all that time too. So that's my thanks to everybody who supported us. And yes, Ken, we're good to go. So, let's see, we'll know, yeah, there we go. All right, so our last but not least, absolutely not least, department to review with us is our prosecutor's office. And
thank you.
The floor is yours. Please introduce yourself and everybody you brought with you, and it's all yours.
I think I know most of you. I'm David Williams. I'm the Chief Assistant in the Prosecutor's Office. I'm joined by Betsy Haig, our Chief of Administration, who also heads up all of our juvenile lawyers, oversees everyone. It'll be okay? All right, thank you. I appreciate that. So I'll try to keep my remarks brief. There are just a few things I want to share with you. The first is I remember Betsy and Karen and I being in front of you 5 years ago. And Karen talked about, she'd just taken office. We'd walked through the office and the conditions there, both physically and technologically, the office was in shambles. And some of you all came over to the office and actually physically witnessed that and saw what the conditions were. And when you walk in today, it is an entirely different experience, both in terms of just the physical space and all of our technology. And on behalf of myself, Karen, Betsy, really everyone in our office, we really appreciate the support you've shown us. It's made a huge difference. I remember when we first got there, I would come into someone's office and they were trying to review files. And I would be talking to them about a PDF and they'd scroll and the screen would just lock up. And I'd say, well, okay, what's wrong with your computer? And I said, oh, that's just the way it goes. That's just the way it goes. They would have to reboot their computer. And I told them in a county like Oakland, we do not have to have technology like that. Other divisions don't have that offices. And we've been completely updated, and it's really a huge improvement, so thank you. Today, I'm happy to tell you we come to you with no additional asks. We're not asking for any additional commissioners. Yeah. But, okay.
Mike's fine.
But that doesn't mean I don't have a couple things I quickly want to share. The reason that we don't have asked this year isn't because we don't need resources. We do, but we are very pragmatic. We're very mindful of our obligation to all the citizens, all the business owners, all the taxpayers in Oakland County. Every year we've been under budget, and we're on track to do that again this year. We have streamlined our operations in a number of different ways. We've modernized our operations with your assistance. We've reallocated human resources to try to take advantage of the new electronic systems we have. People don't have to move paper files around the office anymore. They can be doing more important work, so we've done that. We've also been able to send our assistant prosecutors to professional trainings, and that's made a big difference for them, both in terms of the quality of their work and training, but also for morale. Professionals in our office really, really want the opportunity to advance their understanding, and that's been very meaningful also.
If you could just try and stay close to the mic.
Will do, thanks. But our resources are still limited. Every day we do have to make decisions about where to put our assistant prosecutors. Right now, pretty much all of our divisions, the majority of our divisions, are down at least one assistant prosecutor. And so I would come to you and say, we need positions, but that's not the problem. We have those positions. It's very difficult to fill them right now. And this is not a problem that's unique to the Oakland County Prosecutor's Office or prosecutors. It's sort of a universal problem, but it's especially true for prosecutors' offices. And I want to tell you a little bit why that is. It's true here, it's true across the country. We have a better luck retaining folks, it's not really just luck, than they do in most counties. A lot of counties are down many prosecutors, Wayne County. There are places in the state where they have no prosecutors. If you wanted to be the serving elected prosecutor, you could drive up there and take that spot today. Part of the problem is does that sound good? Part of the problem is we are competing with private practice law firms and attorneys. They can pay more, and a lot of times they offer to have their attorneys work from home full-time. That actually saves them leased space, and that's a perk for a lot of our folks. It would be casual every day, and you can wear your sweats and make more money, and so we have to compete with that. We've found that the younger workforce is more willing to change jobs. They're less attached to the idea of working for someplace for a really long time. So we have folks who can leave for private sector jobs, but they also have the option to become public defenders or defense attorneys. And that's what I want to talk to you about. You already know about how the public defender's office is funded, and IDSO, that's part of the budget that you all see. But that change, which was a positive change, all defendants need to be competently represented, and the system was broken, and that's appropriate. However, that change impacted our workload as well, and there was no legislative allocation or fix or acknowledgement of that when that legislation passed. Since 2024, IDSO attorneys are no longer paid by the filing or the appearance, they're paid an hourly rate. And what that means is they have incentive to file motions and hold hearings where before they had a disincentive to do it. Again, that's appropriate, that's not a bad thing, but it means we see more motions and have more hearings now than we did before, and we don't have more prosecutors. So the result has been we have had prosecutors leave. 3 of them have left for the public defender's office with the lure. They were told you can make more money and work less by either taking appointed work or by working in the public defender's office. And objectively, we believe that to be true. The way IDSO is funded, they have caseload standards that they follow. If your attorneys get up to a certain caseload standard, you can send them out to the contracted attorneys. As you know, about 80% of the cases, I think, are with appointed cases are with contracted attorneys. 20% or so are with the public defender's office. So if the 14 attorneys at the public defender's office, their caseloads are full, those cases go to outside attorneys. We don't have that at the prosecutor's office. When our caseloads are full, we just add to people's caseloads. And we're dealing with that, and we're also dealing with this deluge of electronic evidence. As you know, with body cams and cell phones, we see so much more evidence than we ever have before. So those are the challenges that we face. We are looking for ways to leverage the other pieces of the puzzle to try to make up for that. And one of those is to look for technology that helps, and we're doing that. We're piloting some AI programs to see if we can find work that really is repetitive and doesn't need to be done by an attorney and can do that electronically. And then we're also looking for how can we move work from attorneys who are highest trained, highest paid individuals and push that down to paralegals or to support staff. And so we're doing that. And so I hope that those solutions will come to fruition. We'll still be able to make progress this year. And next year, commissioners, maybe I'll be back asking you for positions again if we fill them all and we solve that. Or maybe I'll tell you AI has taken those jobs, hopefully not. So thank you. And Betsy and I are happy to answer any questions.
Okay. I will open it up to the commission. Come on, you guys got to have some questions. You're not all burned out. Yeah. Commissioner Smith-Charles.
Yeah, thank you. Do tell Karen we missed her.
She's watching, so she'll hear you.
Oh, okay, good. A plethora of questions, but I'll limit it to one of our favorite topics is anti-human trafficking. Not human trafficking, but anti-human trafficking. And to ask, how does that impact your budget? I know there's probably some sheriff aspect to it. Maybe there's some federal grants, things like that. If you would just share how that's looking.
Thank you for asking, and I really should have included that in our in my presentation. That is such a tremendous success story. Human trafficking has been going on for a very long time. It's been going on everywhere. We just didn't see it, even though it was pretty much right in front of our faces. And Karen knew it was an issue and knew it needed to be addressed, knew that we were actually prosecuting women who were victims and calling them prostitutes when they were actually human trafficking victims. And so when she came to the office, she changed the drug unit to a trafficking unit. But what really, really changed the game was a training that was done for about 300 people in law enforcement, in the medical profession, about how to recognize human trafficking and what to do with it. When that happened, the cases just came in an avalanche. And the sheriff's office has allocated resources. Some of the other police agencies have allocated resources. We have the Human Trafficking Task Force, and we're tackling those cases. And we're actually announcing tomorrow a program to try to use nuisance abatement as another way to try to chase some of these illicit massage businesses out of town. In terms of our budget, you all did approve some positions for us. We were able to fill some of those, but we are still trying to fill positions. But human trafficking and trafficking has taken it's been a top priority, and so that's one of the first places we've put people to address that. In terms of our budget, it's really just that we have more work. Those cases the crimes were happening, but they weren't being addressed or prosecuted, and now they are. So unfortunately, we have more work, but it's a good thing, and we've helped a lot of victims. I hope that starts to answer your question. Thanks.
Is that it, Commissioner? Yes. You said you had a whole bunch of questions.
But since we're talking human traffic prevention, that's one of the things that I love to talk about, but also I love the results that we're having. Mm-hmm. Mike Spiz and I, Commissioner Spiz and I, sit on the Human Trafficking Prevention Committee, and I don't know if everybody saw the Facebook article or the Channel 4 where they talked to Officer Mike from the Sheriff's Office. I'm sorry, Mike Miles, yeah.
Yes.
Eminem.
Yeah.
And Ms. Betsy Haig from our prosecutor's office. You were also, no, Cindy. It was Cindy.
Yeah, Cindy Brown, the chief of our trafficking division.
Yes. And there has been so much, I don't know, I want to say progress in that area. I believe just on the one sting that they talked about on Channel 4, in 5 hours, 45 arrests of Johns. 45. And the arrest record, I believe, we're not only doing arrests, but we're also doing prosecutions. So people are also being prosecuted.
Yeah.
You're not just, I
can talk about that for 1 minute because it's sort of a terrible story, but also gives you an idea of what's going on. So they did a sting where they set up a thing where they basically put a fake ad out, and men responded and made a, quote, date, and they showed up, and then when they got there and they got to the room, they would arrest them, right? And so they had people lined up to go ahead and do these arrests, and they had so many men show up, they had to shut it down and cancel people who were coming because they didn't have enough people to arrest everybody.
Wow. Amazing.
One of them showed up with a gun, and that also delayed the process because they had to handle that. So there's plenty of people to prosecute, unfortunately. Part of the goal is to get the word out, and we think that we can decrease demand by bringing light to this problem. I think some people think it's a victimless crime, and it's not. And when people know that, I think we can drive demand down, which will also help.
But this is also where we're asking for partnership from the state and federal government to, when someone is prosecuted, that they get a higher, a more, stricter penalty.
Yeah.
The penalties have to be increased, because right now it's just like a slap on the wrist. So they come back and do it again.
Yes, for our Johns, for the men who are buying the people who are being trafficked, the penalties are extremely low, and so that does need to be changed. I will say, In terms of traffickers, the penalties are pretty good, and Cindy and her team have done a very nice job of putting people who are doing this away for a very long time. So we've been very successful at that.
And that's also one of the things that, and I'm gonna not, well, I could talk about it more, is where I always like to say that when we know better, we do better. In November-December timeframe of 2024, when the prosecutor's office put on the training, I believe that opened up the eyes of so many people, sheriffs, doctors, nurses, everybody, so that the victims could get complete wraparound services. And from that time to now, the information has just been tremendously received, and people have learned from it, and the victims are treated more like victims and not lawbreakers.
Right.
So it's just a lot. And I get very excited about this because I can see the progress that we've had just over the last year or so. So I don't know if you want to talk about the training, if there's more. Well, I know that there's more coming up. You've got the event tomorrow.
Yeah, so we've got an event tomorrow in Royal Oak with all the police chiefs. We've invited the mayors, the clerks, and so forth to talk about this nuisance abatement where you can basically shut people down, padlock the buildings if they don't clear out, and we know there's trafficking going on. We are going to do additional training. We've been asked by law enforcement to put on that training again, and I know we're going to do that. Cindy is out in the community. I know she spoke at a senior center last night or the night before, and that's exactly what people said. It's very eye-opening.
Mm-hmm.
And so I think the more education we're doing, the more support we're getting. And I do think we're really making a difference. And I really think we're going to be able to eventually dramatically decrease the amount of human trafficking, at least in Oakland County. Yeah.
Thank you.
Excellent.
Thank you.
Commissioner Erickson Gall.
Thank you. I'm kind of both happy and sad to hear that you're having, that you don't need new people, but you're having trouble placing the positions that you have. Those of us who measure our law careers in decades remember when prosecutor's office was like highly competitive. People would, arm wrestle to get those entry-level positions. That was the gold standard of where to start your legal career, and that's unfortunate. Do you have strategies or some thoughts, some creative ideas for how you're going to recruit more people?
So one of the things we found is very helpful. Karen personally does outreach, and Betsy can probably talk a little bit about the other steps we're taking. In general, we have been more successful than other counties. But part of the problem is, as you said, people start out in the prosecutor's office. It's a great experience. That's where I started out. When I got my job there, I had to wait like 3 months until a spot actually opened up. But now we do find people are more willing to leave. And so we've thought a lot about how to retain people. We do have concerns about the pay being higher in certain places, certainly as defense attorneys, public defenders. But we are coming up with strategies. So.
Yeah, I would echo David's.
Use the mic, please, Betsy.
Yeah, sorry. I've never been told I'm not loud enough. I would echo David's sentiments. It's still the gold standard for where to start your career. It's just the quality and level of candidates that we're getting is not the same. I think as David mentioned in his remarks, 6 years ago, there was sort of a shift in people's perceptions about working for a prosecutor's office. And that's something that we've worked really hard in our community and throughout to go into the law schools, to connect with the students. We have a very robust internship program that just concluded for the summer. And we have had at least 2, possibly 3 interns that have come through all the way to being hired. We have one that's starting actually next Tuesday, who is an intern in our office for summer. So we are finding new and creative ways for our office to recruit and identify quality candidates, and we continue to work to do that. And obviously, of course, if you know any attorneys who need a job that are good quality, we would love to hear from them.
Also, and you'll know this, bar passage rates have been down for a couple of years. And of course, that just decreases the pool of new attorneys that are available. So lots of challenges.
Interesting.
So the nuisance abatement, are those civil actions?
Yes.
Okay.
And it's been very successful in some other states and very successful in Wayne County on other issues, not necessarily illicit massage businesses, but I'm sort of previewing tomorrow. But you can get a lot of folks, landlords, who either don't know this is going on or sort of been looking the other way to shut them down if they know that the city's going to come after them. Because honestly, what I'd love to do is have raids on all of them and free all the victims and prosecute all the proprietors, but there's not enough law enforcement anywhere to do that. There's too many of them. And if we can run some of them out of town with a few letters, that would be great. But yes, they would turn into civil actions if we have a business that refuses to close or a landlord who won't cooperate. I suspect it's going to be a pretty small group, because I think these folks have been able to just operate with more or less impunity. And when someone's causing them trouble, they will simply move to another location, in this case, another county, where they won't be prosecuted. And there, unfortunately, are places nearby in Michigan where they're pretty sure they're not going to be prosecuted.
Yeah. Well, hopefully you can get some of those attorneys that want to do civil actions, the ones that want to be in their sweats from the waist down and be doing Zoom court with a suit on.
Yeah.
That's my style. The only courts I appear in are online. So thank you.
Thank you.
Anybody else? So you've been here before talking about how you needed to hire people.
Yeah.
And
Yeah.
now you have the positions, but it's sort of the flip.
Yes,
So,
yeah.
okay.
If we can,
I just want to make sure I understood that.
if we
correctly.
fill all our positions, I can't tell you how happy we, Betsy and I, and Karen and the admin team would be, but really our assistant prosecutors, because honestly, they're busting their tails. They're working very hard. They're having to pick up when someone's on maternity or paternity leave, when someone's on vacation. We've had a couple people out on medical. They pick up the slack. And so all of us really would like to fill those positions, but we also need to make sure they're high quality people that are going to act in the interest of public safety and with the highest ethical standards. And so we have to be choosy.
Okay, and then your grant funding is, you have 78% of your revenue is federal grants. That's what your chart says. And 22% is non-federal.
Yeah, I think
Of our revenue, because we're not a revenue generator.
Right.
So it would be 78% through our family support division, and then our victim services, and we have a grant through the state for purposes of auto theft. 2 positions for auto theft. Those are positions we have not yet been able to fill because we are prioritizing other litigation positions within the office. We don't have any concerns about effect to our federal grant or it's related to our family support division, which is the division that seeks child support on behalf of children whose other parent is seeking state aid. So we don't have any concerns about that funding. Additionally, we've been assured with regard to our Crime Victims' Rights Grant that our funding will continue in the next fiscal year. Although I think like everyone, we have concerns about our grants, right? But the federal grant, we have no reason to be concerned about.
Yeah, okay. I think the thing that has scared us the most is losing any of our victim advocates. Something like the auto theft grant, we haven't been able to fill that yet because it's not our number one. If we get a new attorney, that's not where we're going to place them, but we do hope to fill that. But if we had that person and we lost that grant, it's very likely we'd be able to move them into a different position. So we're feeling fairly comfortable with that. The thing that really scares us is losing any of our victim advocates. The last couple of years, we felt there was risk, and it's turned out fine. But we do have an eye on that because that would be a real tragedy for victims.
Okay. Going once, going twice. Nobody has any more questions for the prosecutor's office. I will say we are concluding this review.
Thank you very much.
Thank you for coming in. And that concludes the budget hearings for 2026.
Congratulations, yeah.
We do need a public comment, though. There is a public comment. Oh, you're... All right. So I'm just going to go back to my agenda here for a second. Yeah. Where'd I go? Yep. So all we have left is a public comment. Is there anyone who wishes to address us at this time on any subject? Okay. Seeing no one, I will close public comment. Is there any other business? Seeing none, I will call this meeting adjourned at 4:40.